I'm going to introduce another talented panel that we're going to have. And the first speaker, Jim, if you'd come up, is Jim Fabisiak, who is Associate Professor of Environmental and Occupational Health at the University of Pittsburgh Graduate School of Public Health. He directs something called the Center of Healthy Environments and Communities, Environmental and Occupational Health. Jim's work as a toxicologist explores the cellular and molecular mechanisms by which various air pollutants and other inhaled toxicants produce lung injury and respiratory dysfunction. That's what it says here. I actually just spoke to him, and he's going to say a lot more than that. So I look forward to his presentation.
Okay. So first off, can everybody hear me? Okay. Okay. So I want to thank Molly and Polly and everybody who helped organize this meeting for inviting me. And what I'm going to try to do today is essentially give you an overview. I've sort of got charged with the task of sort of introducing carcinogens that are in the air. So things that we breathe and what their role in cancer might be. I'll try to, when I can, put this in the context of sort of what goes on locally in terms of Southwest Pennsylvania or Allegheny County regarding some work that we did, but also in a broader context to some extent. So this is really some similar data to what Dick was just showing, actually from the same database, but I think kind of points out the fact that cancer incidence for a variety of cancers is significantly elevated in Allegheny County compared to national averages. So what you kind of want to pay attention to are the red bars. So that's where there's a statistically significant difference. You can see a small increase in all cancers, but especially if one considers cancers of the larynx, the lung, thyroid cancer, bladder cancer, many of which do have some link to air pollution. And so that is at least sort of circumstantial evidence that high levels of air pollution might be contributing to increased cancer within our area. And so basically Pennsylvania ranks 5th highest in overall cancer rate in the US during that time period. So just by way of introduction, certainly most of you are familiar with some of the environmental risks associated with cancer. This is a partial list. The ones that are shown in blue are at least have some component of being exposed through the respiratory route, and so things that are in the air, things that you breathe, those are represented by the ones that are in blue. I do want to sort of also take a moment to discriminate, at least in my mind, what I consider to be causes of cancer. So something like tobacco, clearly we understand that mechanism in great detail, and we can sort of easily say that causes cancer. Others we know are certainly associated with elevated risk of cancer. I sometimes have a difficulty understanding the mechanism of how obesity or lack of exercise can produce cancer, but it undoubtedly contributes to cancer. And one of the things I want to sort of get to the end is that many of these sorts of things that we consider to be risk factors have the potential to interact. So maybe by being obese or having poor nutrition actually increases your risk for getting cancer by one of those known causing cancer agents in the environment. So since we're sort of talking about cancer in the air, we have to think about lung cancer sort of as the prime target. This is just a graph that looks at who gets lung cancer and perhaps why. So the graph on the left shows the incidence or the sort of the cases of cancer that develop in people who either have smoked or are currently smoking. Those are the sort of two blue pie charts or pie components that you see there. That represents about 90% of the cancers, of lung cancers, occur in people who have some smoking history. But about I can't see the slide too well here, but 10 or 15% essentially lung cancer develops in patients or in patients who have no smoking history. So people who don't smoke do clearly have the ability to develop lung cancer. The graph on the right sort of looks at what might be the 4 major causes of lung cancer, and you can clearly see that smoking is the variable that's most associated with smoking. Radon, which is something we haven't heard too much about here, and I'll talk a little bit in detail about. Since I'm talking about carcinogens in the air, I think it warrants some discussion. Occupational exposures, and then ambient air pollution as well. And that study on the right sort of says that ambient air pollution accounts for about 2% of all lung cancers, but more recent data basically implies that ambient air pollution may actually account for as much as 5 or more % of this. And actually the IARC, the International Agency for Research on Cancer, estimates that about 100,000 to 200,000 lung cancer deaths result from exposure to ambient particulate matter. But we'll talk about radon a little bit, and this is actually data from the SEER database that we talked here a little bit about, showing essentially the estimated number of lung cancer cases that arise through radon exposure. Average is about 21,000 cases per year. That's a little hard to estimate, so there's a range of uncertainty about that. So somewhere between 8,000 and 40,000 lung cancer patients are accounted for by radon exposure. About 15% of those will occur in non-smokers. So here's one case where radon may be having an effect in people who smoke cigarettes. But when we're trying to sort of just simply look at what the cause of someone's cancer is, if they smoked cigarettes, we immediately throw them into the bin that smoking caused their cancer. But I would sort of put forth that there can be some synergy between that, and that the risk of radon is liable to be much greater. And in fact, I'll show you some data in people who smoke cigarettes. So multiple carcinogens interact synergistically to affect your risk of cancer. So what is radon? It's actually one of these things that we can't blame on what man does. We can't point our finger at the Claret and Koch works. It is the second leading cause of lung cancer, however. It's a naturally occurring radioactive element that occurs naturally in the soil. Especially dangerous because it is a gas. You can see sort of radon as the second member of that chain of radioactive decay from the element of radium. So radon is a gas. It's in the atmosphere. It enters your lung. If that radon decays while it's in your lung, that causes the next element to be a particulate. So it deposits in your lung. It's not easily exhaled. And you can see that once that's deposited, there can be a series of radioactive decays that continue to happen, that continue to assault your DNA and potentially produce a mutation. So how are we exposed to radon? Primarily in our house. Concentrations in the indoor environment are certainly greater than what we see in the outdoor environment. Comes into your home primarily through cracks in the basement, where a sump pump might be installed in the floor of the basement, joints between the walls and the floor of the basement. And routinely, concentrations are higher in the basement environment than they are in the upper levels of the home. So in some ways, radon is actually low-hanging fruit. If we're looking for something that is going to be amenable to prevention, it's really a fairly straightforward thing to approach. However, we don't necessarily have all of the tools, and people are not very appreciative of this as a risk. So for example, the US EPA estimates that about 6% of homes in the US have radon which is greater than 4 picocuries per liter. And that's the level that the EPA recommends that you might want to consider having some remediation done in your home. And actually, remediation is relatively straightforward. Standard remediation, you sort of see that apparatus on the right there, costs about $800 to $1,200 to install, and that's pretty good at removing radon that's in your home. Pennsylvania in particular has high levels of radon because of our geography. Pennsylvania DEP estimates that about 40% of homes in Pennsylvania have radon levels above that 4 picocuries per liter threshold. So who's tested? Who's tested their home? Can I have a show of hands? Who's had their home tested? Okay, well, we're pretty environmentally conscious. I looked for that number in Pennsylvania. I couldn't find one. The best number I said that I could find was the state of Minnesota estimated that less than 1% of homes in that state are actually tested for radon. So ignorance is bliss, I guess. Okay? And so I also want to illustrate the fact that these averages can be misleading. So this is actually data taken from Erie County, which is that county sort of on the western part of New York State there. You can see the arrow right about here. So as far as the EPA's designation of a high radon area, Erie County fits within that definition. Okay? If one looks at the houses that have been measured in Erie County, however, the average number that comes up is actually on the order of about 0 to 1.9 picocuries per liter. So the average looks pretty low. But what I really want you to pay attention to is the graph on the right, which shows that a number of homes can have really significant levels of radon. And so the largest circle there, for example, I think is on the order of 300 picocuries per liter. And you can see some arrows that I have showing where those circles are in that county. So clearly there are some houses that have extremely high levels of radon. And secondly, note that many of those homes are actually next door neighbors almost, with people that have low radon readings. So simply because your neighbor has had their home tested and you have a low radon number doesn't mean that your home is necessarily going to reflect the same condition that your neighbor is. So just to move on and kind of talk a little bit about air pollution. We know the role of smoking. We know the effect it has on lung cancer. And I just sort of sardonically put this picture up which says, what do all these things have in common? And they're all generating smoke when something burns, okay? We have mobile sources of air pollution, stationary sources of air pollution, burning biomass even in our backyard, all produce pollution which has been documented to be known human carcinogens. We have several classes of air pollutants, the national ambient air quality pollutants, things that we think of as PM2.5, NO2, sulfur dioxide, a handful of about 6 agents which have national ambient air quality standards set for them. So all communities have to measure this particular chemical. If you are above a threshold that's been set based on the health determined standard for that, then your area is in non-attainment and you have to take special steps in order to compensate for that and correct the situation. And in fact, one of those, PM2.5, International Agency for Research on Cancer, has identified as a known human carcinogen and does indeed count for a significant burden of lung cancer from that particular pollutant. The other class is hazardous air pollutants, which are regulated sort of under a different series of statutes under the Clean Air Act, includes about almost 200 odd chemicals. No health-based standards are set for that because it really is impractical to measure that many chemicals in that many, all the areas of the country when maybe they're only released by a handful of industries. So we don't really measure them and we don't really have health-based standards for them. They're basically regulated at the level of what's the best available technology to mitigate their release, not so much from what the health impact is going to be. And actually, out of that 187, about 1/3 of them are known human carcinogens. And we spent some time looking at this within the context of Southwest Pennsylvania, the 10 counties that essentially include Allegheny County, as well as those around it, and looked at cancer risk as it was predicted by the National Air Toxics Assessment, which is a database put out by the EPA about every 3 years, which models the concentration of those 187 air pollutants. Those that are carcinogens, they estimate the risk of cancer, the lifetime risk of cancer, per million people that are exposed to that particular concentration. So I want you to also realize that when I talk about risk now, I'm not talking about rate. Rate is something that is actually measuring the number of cancers that are being counted. Risk is essentially an estimation based on that concentration as well as the best available science that predicts how much unit of that pollution accounts for how much risk of cancer. And so this particular area here in Southwest Pennsylvania, the average cancer risk from these hazardous air pollutants was about a little over 120 per million people. Residents of the Allegheny County, which is more urbanized, have about twice that risk. as opposed to those in rural areas. And Allegheny County ranks 63rd out of about 3,000 plus U.S. counties. That puts it in the top 2% nationally of all counties in the United States for cancer risk attributed to all of these various air toxics. And you can even see that even some areas, for example, down here, have levels of risk that approach greater than 1,000 per million people. Those particular areas are actually near the Claret and Coke works. These were the top 10 cancer drivers that arose from that sort of analysis. You can see that diesel particulate matter, formaldehyde, coke oven emissions, certainly here within the top candidates. By far and away, out of these top 11, diesel exhaust particulate matter was the one that accounted for the most risk. Out of the total risk of these 11, 122, 93 were accounted for by diesel particulate matter. I just wanted to show you this based on some of the conversations we've been having about environmental justice and disparities of exposure. So this was when we looked at the diesel exhaust emission data, or diesel exhaust exposure data, for all 400 census tracts in Allegheny County. And you can see that what we did here is we ranked every census tract from low to high. So 400 census tracts, there's a little bar for each of those. And then ask the question, okay, amongst those, where do neighborhoods of predominant poverty and non-white minority populations live along this exposure continuum? And that's actually shown as the red bars. So an environmental justice census tract is characterized by greater than 30% non-white minority and or greater than 20% in poverty. They're clearly skewed towards the right upper regions of exposure. And in fact, we can quantify that and say that there's a 20%, actually a 20-fold greater incidence of an EJ tract to occur in the top quartile of exposure compared to the lowest. And it goes up progressively as one goes along that exposure continuum. So that's diesel exhaust. But what about other, because all urban centers really have some component of diesel transportation as part of their risk, and it clearly was one of the greatest in our region as well. But to more readily address point source pollution and non-diesel, we took that out of the equation and then asked, okay, what are the risks to the, if we take diesel out? And so if we look at that, we find that Allegheny County actually ranked 21 out of 3,000 plus counties in the US. Now that puts it in the top 1%. So if we look at, other problems besides the diesel traffic here, our ranking actually goes much higher. We are much more impacted by that than other areas of the country. Almost 40% of that risk could be attributed to point sources, and a lot of that is indeed the coke works. For the right graph basically shows the sort of profile of risk for cancer as posed by the coke ovens within Allegheny County. And so progressive blue means obviously the risk is going down by distance, but that risk really goes out quite a ways from the Claret and Coke works. It may be small as one gets further away, but could still be calculated in a way like this. And basically we did this with our version, looking at the 208 NADA data. My colleague John Graham, who is also here, essentially found the same data with looking at a more recent version of NADA from 2011. So the same effect was found in whatever one we looked at. The other thing I want to point out is that we don't know everything yet. So we continue to evolve new science that allows us to make predictions on cancer risk that may change over time. And this is an excellent example because the most recent version of the National Air Toxics Assessment has just recently come out within the last couple of months or so. And what has happened here, this is actually an example of a region in Allentown, which has, you can see that there's cancer risk shown here with these colored, which reaches on the order of 5 or 600 cases per million people, centered around this particular point right here. This represents a source of a chemical called ethylene oxide, which is actually used in the sterilization of medical equipment. So this is an industry that we don't normally think of as having a sort of polluting effect. But now we have this new science, essentially as the result of these studies here, which allowed the EPA to create a new slope factor, a new unit risk estimate for ethylene oxide. So there's been no change in the emissions over time, but yet the apparent cancer risk has gone from 8 to 500 to 600. So these are the various census tracts that are located within this colored area, and you can see how the risk has apparently changed over time. Not because emissions have changed, but because our understanding of the science has changed. There will obviously be some industry pushback from this. The other thing I want to sort of make a point now is the interactions between potential chemicals. And so we know that there's well-established synergistic effects with smoking and occupational exposures to asbestos. So this is an example here where you can see the risk of getting lung cancer. If you are no asbestos, no smoking, we'll call that 1. If we're exposed to asbestos alone, our risk goes up a little bit. If we're only smokers, our risk goes up a little bit more. But put those two together, the risk is more than additive. So there's a synergistic effect. If I smoke and I'm exposed to asbestos, then my risk of getting lung cancer is much greater than simply adding those two risks together. This graph basically shows the same thing for radon and smoking. So this is the risk of getting lung cancer if you don't smoke with various levels of radon. And because this risk is so high, if I plotted this on a different scale, I would see a slope. So there would be an increase in this white line. You can't really appreciate it there. But if I smoke and I live in increasing amounts of radon, my risk of lung cancer goes up dramatically. Again, a synergistic effect. I always like to show this slide because it's sort of intriguing, and it talks about the effect of air pollution on people who have lung cancer. So let's not think about air pollution causing lung cancer, but what's the effect of air pollution on people who have lung cancer? And this was a study that was done by Sarah Eckel in California, looking at over 300,000 lung cancer patients who have their disease staged in terms of localized, which means a simple local tumor, regional, which means there's been some metastasis, or some invasion of the local tissue, and then distant, which means there's been metastasis. So think of this as different severities of lung cancer, localized being low-grade disease, distant being high-grade disease. And then it looked at those people, and it said where they lived in terms of their air pollution exposure. So we have less than 10 micrograms per meter, PM2.5, increasing doses of that. We can see those with mild disease fare worse in terms of median survival in the higher levels of air pollution. Okay? That fits in with this model that cancer is really a multifactorial disease. Those people who have low-grade cancer can develop other mutations, whatever. Their disease becomes more severe, and they have poorer prognosis in areas of high air pollution. You don't see the effect in someone who has severe lung disease because they're really about as severe as they're going to be. They're not going to live very long anyways. So I find that sort of an intriguing thing. So this is my last slide, because you wanted me to sort of talk about what might be a recommendation. And I put up this sort of personal anecdote. This is my dad. He actually died of lung cancer about 3 years ago. And so kind of like any parent or any child, you sort of sit there and say, what was it that might have caused his lung cancer? And this speaks to the concept that we heard earlier about trying to be able to predict risk in a population versus risk in an individual. Okay? So I had this conversation with myself, and I said, well, Dad was a smoker. He lived till he was 93, and really only had his diagnosis of lung cancer within the last 6 months of his life. So very productive life. There's nothing to sort of think about that way. But He was a smoker, but he quit when he was like 60 years old. So he had 30 years of being cancer, at least no signs of cancer that we knew of. He worked in the newspaper industry, and I could show you an epidemiological study that says people who work in the printing industry, because of the sort of carbon black and that's in the atmosphere, and I went to visit him in the work a few times, and it's not a pretty place to be. Those people have a higher risk of cancer. So what's the contribution from his occupational exposure? When he retired, he also spent a lot of time in the basement. And I can't say that I know what the radon concentration was, but because of his hobbies and his activities, he spent a considerable amount of time in the basement. So what's his radon exposure? So what's the big picture there? Rather than focus on one agent, how can we think about multifactorial agents? And that's kind of the recommendation I wanted to sort of leave you with, was that we should develop policies that integrate the complete array of environmental factors, risk factors as well as causes, as well as the various genetic and epigenetic influences. Consider cancer as this multifactorial disease and not assigned to one exposure versus another. Continue to identify and characterize novel factors. For example, that ethylene oxide that I talked about. Now we're going to see some research on what ethylene oxide really does. Consider cumulative risk from multiple exposures. And the last thing to mention is this sort of concept that has been incredible in terms of advancing cancer treatment, and that's personalized medicine, right? Individualized medicine. Our ability now to take a piece of someone's tumor, analyze those mutations, give them selective drugs that we know should work in that tumor. If they don't have that right phenotype or genotype, there's another drug that could work. That's really made advances as to how we can sort of treat lung cancer, because each individual's lung cancer won't be the same. I would like to at least put out there that we think about this concept also now from the sort of conjecture of personalized prevention. How can we sort of make a profile of each individual's risk factors in order to sort of more specifically tailor what might be of benefit to each person? So with that, thank you.